For years, we were told that routine medical tests are the key to staying ahead of disease. Blood work every 6 months, annual cancer screenings, full body scans. These were seen as smart, responsible, even life-saving habits. But what if that advice, especially after the age of 70, isn't just outdated, but potentially harmful? What if the very tests we trusted to protect us are now quietly putting our well-being at risk? This isn't a conspiracy. It's a shift in understanding. Across the medical community, experts are beginning to reevaluate long-standing assumptions about routine testing in older adults. Not because prevention doesn't matter, but because the rules change as we age. The tests that once made sense in our 50s and 60s might no longer be necessary or helpful after 70. In fact, some may lead to false alarms, unnecessary procedures, or treatments that lower quality of life without improving health outcomes. The truth is, aging changes the equation. Our bodies, our risks, and even our priorities evolve. But medicine doesn't always evolve as fast. Many older adults continue to follow testing routines that no longer reflect their current needs, simply because no one told them the guidelines had changed. They're not doing anything wrong. They're just doing what they've always done, unaware that new research is pointing in a different direction. And this matters, because unnecessary testing doesn't just waste time, it can trigger a chain of stress, side effects, and complications that are especially risky in later life. The intention is good, but the impact can be harmful. That's why this conversation is so important. It's not about ignoring health, it's about redefining how we protect it, especially after 70. Knowing what's still essential and what no longer is one of the most empowering things you can do for yourself or someone you care for. Because when it comes to aging well, doing less can sometimes mean living more. One of the quietest problems in modern medicine is how slowly practices change, even when new evidence says they should. For older adults, this lag can be especially harmful. A test that was once routine might no longer be backed by science for people over 70, yet many clinics still offer it. Not because doctors don't care, but because healthcare systems often run on habits, protocols, and outdated checklists that don't always reflect the latest research. Guidelines do change. Expert panels review the data and update recommendations, sometimes significantly. But the information doesn't always reach the people who need it most. Primary care physicians, overwhelmed by patient loads and administrative demands, may continue to order familiar tests by default. Patients, taught for decades that prevention means testing, rarely think to question whether a scan or screening still makes sense for their age or health status. The truth is, inertia is powerful. Once a routine becomes part of a standard checkup, it can stay there long after its usefulness fades. Many older adults undergo repeat tests every year that have little to no benefit at their stage of life, sometimes even when the national guidelines say to stop. And because these tests feel like a normal part of care, no one thinks twice about them. But this automatic approach carries risks. It can lead to follow-up procedures that aren't needed, exposure to radiation, false positives that cause anxiety, and treatments that offer little benefit but come with side effects or recovery time that the body handles less gracefully in later years. Continuing outdated protocols isn't harmless, it quietly erodes quality of life. That's why awareness matters. Knowing that some tests persist simply because the system hasn't caught up allows you to pause, ask questions, and take control. Medicine should be personal, not automatic. And understanding how protocols can lag behind the evidence is a key step toward receiving care that's truly right for you. When we think of medical risks, we often think of diseases, surgeries, or medication side effects. But one of the most overlooked risks, especially after age 70, is the testing itself. Not because tests are inherently bad, but because unnecessary tests in older adults can quietly create a chain of harm that goes far beyond the exam room. And too often, no one talks about it until it's too late. It starts with the test. Maybe it's an imaging scan, a cancer screening, or a blood test that seems harmless. But in older bodies, these tests can uncover things that were never going to cause a problem: slow-growing tumors, benign nodules, or minor anomalies that trigger alarm but pose no real threat. Once detected, these incidental findings set off a cascade. More tests, specialist referrals, biopsies, or even surgery. All of this happens because something showed up, not because it needed to be treated. Every step in that cascade carries its own weight. For an older adult, a biopsy can mean pain, bleeding, infection, or hospitalization. A false positive can cause deep anxiety, sleepless nights, and a loss of trust in one's own health. A treatment for a harmless condition can bring side effects that reduce mobility, appetite, or clarity. These are not rare cases. They happen quietly, every day, to people who simply wanted to stay healthy. What makes this risk even more dangerous is that it often hides behind good intentions. No one means harm. Doctors want to be thorough. Patients want to be safe. Families want to be proactive. But when testing becomes routine without asking whether it's still necessary, good intentions can lead to harmful outcomes. That's why it's so important to understand the ripple effect. Unnecessary testing doesn't just lead to extra paperwork, it can lead to unnecessary procedures, avoidable suffering, and loss of independence. And in the later decades of life, preserving quality, not just chasing numbers, should guide every medical decision. Screenings are designed to catch illness early, often before symptoms appear. And in many cases, especially in younger adults, they save lives. But after age 70, the equation changes. The body becomes more vulnerable to stress, procedures, and recovery. The goal of care shifts from aggressive detection to preserving function and quality of life. Yet many screenings continue to be offered automatically, even when evidence shows they might do more harm than good. One example is cancer screenings. Tests like colonoscopies, mammograms, or PSA blood tests were once encouraged well into old age. But now, many expert panels recommend stopping routine screenings at a certain point, often around age 75 or earlier depending on health status. Why? Because the cancers these tests might find are often slow-growing, unlikely to cause harm in a person's remaining years, and because the treatments themselves can be harsh, invasive, or even dangerous in older patients. Even if a screening does find something serious, the path forward isn't always straightforward. An older adult may face choices between surgery, radiation, or chemotherapy, each with side effects that could outweigh the benefits. Some treatments cause cognitive decline, fatigue, or loss of independence. Others carry a risk of hospitalization, complications, or reduced life quality. In many cases, the disease would have remained silent, but the screening turned it into a battle the body was never meant to fight. And it's not just cancer. Bone scans, heart stress tests, and full body scans often uncover incidental findings. Tiny issues that might never matter but now demand follow-up, leading to anxiety, cost, and often more risk. The intention is to protect, but the outcome can be a life more medicalized than necessary, where the focus shifts from living to testing, from joy to caution. This doesn't mean screenings are bad. It means they must be thoughtful. After 70, every test should serve a clear purpose. Will it change how we care for you? Will it improve your health or peace of mind? If not, it may be wiser and safer to let it go. Because sometimes the best way to protect health is by choosing what not to pursue. As medical understanding evolves, so do the priorities of care, especially after the age of 70. Experts today aren't simply saying do nothing. They're saying do what matters most. Instead of continuing with blanket testing for every possible condition, the recommendation is shifting toward more thoughtful, personalized care based not on age alone, but on overall health, personal goals, and what will truly enhance quality of life. One of the main ideas experts support is selective screening, choosing which tests are still worth doing based on an individual's health status. For example, if a person is active, managing chronic conditions well, and has a life expectancy of more than 10 years, certain screenings might still make sense. But if someone is already managing multiple health issues, or if a screening is unlikely to change treatment decisions, the recommendation is often to skip it. The goal is not to deny care, but to offer care that makes sense for the person in front of you. In place of routine exams, doctors are encouraged to focus more on functional health, how well someone moves, thinks, sleeps, and feels. This includes fall risk assessments, medication reviews, cognitive check-ins, and conversations about sleep, nutrition, and social connection. These touchpoints often reveal more about someone's well-being than a scan ever could. Another important shift is toward shared decision-making. Instead of simply scheduling tests out of habit, doctors and patients are encouraged to talk openly. What are your priorities? Are you more concerned about living longer or living better? Would knowing the results of this test bring peace of mind or just more worry? These questions help guide decisions that are more aligned with the person's values. This new approach doesn't abandon prevention, it redefines it. It sees health as something more than lab results or imaging. It respects the wisdom that comes with age and the reality that more care isn't always better care. And most importantly, it empowers older adults to shape their own health journey, grounded in clarity, not fear. Navigating healthcare after 70 requires more than just following appointments. It requires honest, informed conversations. But for many older adults, talking to the doctor about which tests to decline or which exams to reconsider can feel uncomfortable. After all, doctors are experts. Shouldn't we simply trust their judgment? Yes and no. Because the most effective care happens when medical expertise and personal values meet in the middle. The first step is redefining the relationship. Your doctor is not just a provider, they're a partner. They know the science, but you know your body, your priorities in your life. When you express what matters to you, whether it's avoiding unnecessary procedures, staying independent, or just reducing stress, you give your doctor better tools to tailor your care. Without that clarity, it's easy for them to default to routine. It helps to come prepared with questions. Instead of simply accepting a test because it was ordered, ask, will this test change how we treat me? Or what are the risks of not doing it? You can also ask, would you still recommend this if I were 85 instead of 70? These questions aren't confrontational, they're collaborative. They show that you're engaged and thoughtful about your care. If a doctor pushes for a test that doesn't feel right, it's okay to pause. You can say, I'd like to understand how this test will help me feel better or live better. If the answer isn't clear, or if it sounds like the test is being done just in case, that's a signal to ask for alternatives or wait. A good doctor will respect your concerns and be willing to explain, adjust, or even hold off if the benefit isn't clear. And if you feel unheard, you're allowed to seek a second opinion. Medicine is not one size fits all. You deserve care that listens as much as a diagnosis. You deserve to be part of the decision, not just the subject of it. The best outcomes happen when patients speak up and when doctors are ready to listen. That partnership doesn't just reduce unnecessary testing, it builds trust, reduces fear, and leads to care that honors your health and your voice. After decades of being told that health equals testing, it can feel strange, even risky, to slow down and step away from routine exams. But for many people in their 70s and beyond, that shift is not only safe, it's freeing. Instead of organizing your life around appointments, screenings, and follow-up tests, you begin to focus on something more important: how you feel, how you function, and how you live. This doesn't mean ignoring your health. It means redefining what good health really looks like. It's no longer just about catching diseases early. It's about staying mobile, connected, mentally sharp, and emotionally steady. It's about waking up with energy, enjoying your meals, remembering names, having meaningful conversations, walking without fear of falling, sleeping well, and maintaining independence. These are the true signs of well-being, and they can't always be measured in a blood test. Many older adults report feeling more relaxed, more in control, and more engaged with life once they let go of constant medical surveillance. Instead of waiting for results, they spend more time on the things that bring joy: gardening, grandchildren, hobbies, friendships. They use their energy to nourish the parts of life that really matter instead of worrying about what a scan might show. This doesn't mean being reckless. It means trusting that with good communication, careful attention to symptoms, and a strong relationship with your doctor, you can stay healthy without chasing every possible problem before it exists. It means recognizing that some things aren't worth pursuing if they won't improve your day-to-day life. Living well after 70 isn't about being perfect, it's about being present. It's about focusing on the life in front of you, not the hypothetical risks in a lab report. When testing becomes intentional instead of automatic, you gain more than peace of mind. You gain time, space, and the freedom to truly enjoy the years you've earned. Health, in your 70s and beyond, is no longer about chasing perfection. It's not about catching every possible disease or keeping every number in a narrow range. It's about living in a way that feels whole, physically, mentally, emotionally. It's about knowing yourself well enough to say, I don't need every test. I need what helps me feel well, think clearly, move freely, and rest peacefully. This stage of life calls for a new definition of health, one that honors strength, but also softness, one that celebrates independence, but also knows when to ask for support, one that doesn't demand constant testing and fixing, but instead embraces balance, perspective, and peace. That kind of health can't always be measured in charts. It shows up in how you live, how you connect with others, and how you carry yourself through your days. Letting go of unnecessary tests is not neglect, it's wisdom. It's the choice to put your energy where it matters most. It's the courage to trust your body, your intuition, and your care team enough to say, that test might not help me right now. Let's focus on what will. That kind of clarity is powerful, and it's something only time and experience can give you. Every person's path is different, but what matters most is that the care you receive reflects who you are, not just your age, but your goals, your needs, and your vision for this next chapter of life. Whether you're thriving, managing health challenges, or simply adjusting to a new pace, you deserve a definition of health that gives you room to breathe and live on your own terms. So here's to choosing well, not more, to asking better questions, to trusting what your body tells you, and to shaping a future where health isn't about how often you're tested, but how deeply you're living.